Welcome to the regular meeting of the Public Health and Safety Committee for January 8th, 2025. My name is Jason Chavez, and I am the chair of this committee. Before we begin the meeting, I want to offer a friendly reminder to all members, staff, and the public that these meetings are broadcast live to enable greater public participation. These broadcasts include real-time captioning as a further method to increase the accessibility of our proceedings to the community. Therefore, all speakers need to be mindful of the rate of their speech so that our captioners can fully capture and transcribe all comments for the broadcast. We ask all speakers to moderate the speed and clarity of their comments. At this time, I'll ask the clerk to call the roll so that we can verify the presence of a quorum.
Councilmember Payne.
Present.
Rainville.
Present.
Ellison is absent. Palmisano.
Present.
Vice Chair Wansley.
Present.
Chair Chavez.
Present.
We have 5 members present.
Let the record reflect that we have a quorum. With that, the agenda for today's meeting is before us. There are 4 items on today's consent agenda. Item number 1 is setting a public hearing for January 22nd, 2025 to consider an ordinance amending the Code of Ordinances relating to fees for use of city-owned resources. Item number 2 is directing the Legislative Department to conduct a landscape analysis of state and municipal actions to expand access, incentivize, and/or introduce court-ordered mental illness and substance use disorder treatment, and assess the degree to which mental health and substance use disorder treatment are accessible in Minneapolis, particularly for residents experiencing homelessness. Item number 3 is a passage of a resolution approving grant funding for the compost and food waste reduction partner contracts. And item number 4 is a passage of a resolution accepting a training reimbursement from the Minnesota Board of Firefighter Training and Education. I'll move approval of items 1 through 4. Are there any discussions on any of these items? I'll first pass it to Vice Chair Wansley.
Thank you, Chair Chavez. I did want to speak to both items number 1 as well as items number 2. So first is item number 1, which is setting the public hearing on the city-owned resource ordinance, also known as off-duty. Specifically, I wanted to give some context on this ordinance, which would essentially allow the city to charge fees to recoup the costs associated with off-duty policing, such as the cost of squad cars. On Monday, the city entered into a federal consent decree with the Department of Justice, and the consent decree agreement actually includes a variety of specific requirements that ask the city to significantly regulate off-duty work, and also requires that we pre-approve all of MPD's uses of their equipment specifically for off-duty work. And this really affirms what community members and some council members of this body have been saying for years, that we know that the MPD system of off-duty has been broken, both also inequitable, and overall has been harmful to our citywide public safety efforts and the rebuilding of trust of it amongst the public. So with that, my office has been working for nearly 3 years to pass these type of regulations, and we've also have faced many hurdles in getting buy-in from city staff to move forward with this work. But despite that resistance, I do want to note that, my goal has always been to pass these fees related to off-duty work for 2025, and I'm glad that we are back on track. And I'll discuss more at the actual public hearing, but I do want to note that, the delay from the Fry administration in implementing this fee is not only bad public policy, but it's also a bad financial one. And according to MPD's own financial, or specifically their records noted in a staff memo from last year, had we implemented a fee that could cover the cost of fees associated to off-duty, programs such as squad cars, the city could have recouped up to $1.4 million. And as the city continues to face what will be fiscally challenging years, we need to be rigorous in our oversight and more thoughtful about how we both manage and spend our city resources. And, while the mayor has sole authority over MPD and its policies and operations. I am glad that the council continues to take serious its role in utilizing our oversight functions to ensure transparency and accountability as it pertains to MPD. And council advancing this work is an example of how we can close the gaps that are left open by the administration. So I look forward to passing this ordinance and implementing fees on off-duty policing programs as soon as possible. And as it pertains to the staff motion, specifically the research on care courts and mental health and substance use disorder treatments in Minneapolis. I'm going to be voting yes on this item because I believe that any opportunities that the council has to be informed about, subject matter, especially related to this committee work, is always great. And conversations about policy should be talked about and debated in the public. So again, I look forward to the information related to this item coming back to committee for further conversation. However, I do want to emphasize that I have deep concerns around coerced approaches to treatment. It was noted in the preliminary assessment memo attached to the LIMS file that the policy and research team compiled that the ACLU and disability rights groups are vocal in their opposition to California's new care courts legislation and policies. So I don't think we should be taking that lightly as we have this conversation, and I don't want anyone in the public to misconstrue my vote today as being taken as affirmative of any type of coercive treatment measures that we are possibly looking to pursue here at the city, or some council members are looking to pursue here at the city. So I just wanted to name that and give clarity. So just wanted to share those things.
I also want to acknowledge the presence of Councilmember Ellison for the record. And next, I'll give it up to Councilmember Rainville.
Thank you. I do want to speak to item number 2, and I'm the council member who is advancing this. So I do want to be transparent and say this is coming from me, and I appreciate the help and support I've gotten so far from Council President Payne, because we have talked about this for well over a year. And I think this is just another piece of information that we need as we go forward. As I looked on the dais, there was actually 4 of us who were at the meeting over at the Native American Center yesterday to talk about the crisis we're having with homeless, and the subject of addiction and mental health came up time and time again. And I appreciate the vote from Councilmember Wansley, although she might not agree with what she feels is the intent, and I would ask to keep an open mind. But I want to leave with what came up yesterday, which was the question, which has no answer so far, is how do you help someone who will not help themselves? Thank you.
Thank you. Next up is myself. I just want to make a few comments about item number 2. I'll begin by saying that I think the second component, which is assessing the degree to which mental health and substance use disorder treatment are accessible in Minneapolis for residents experiencing homelessness, is something that is very interesting to me. So I'll be supporting, while I don't support the entirety of this legislative directive, I do support that second component, which talks about the mental health services that are available in the city, which I think aren't as much as we deserve and need for our unsheltered residents. Now, when it comes to the forced coercion of unhoused residents in California's law, that is not something that I support. So I just want to make sure that any residents that are watching this today, me voting in favor of this is just getting more information because I think learning about this is important. However, I do not support the practice of forced coercion or the work that California is doing when it comes to this particular topic with care courts. I just want to be very clear on that component. So I do want to thank Councilmember Rainbow for bringing this forward, particularly the second bullet point, which I think is something that would be beneficial regardless of what policy is moved forward or not. With that, I'll pass it on to Council President Payne.
Thank you, Chair Chavez. I want to thank Councilmember Rainville for bringing this forward. As he mentioned, we've been discussing this for over a year. I, too, express some reservations about coercion, and I'll also echo the sentiment that the more information that we have on this topic, the better. And just as we move forward, I'm just really curious to see what other jurisdictions are doing. I read in the New York Times, for instance, that LA was meeting people where they are, and they were actually doing medication with folks that were living unsheltered, but they were doing an injection. And as we just saw in our consent decree that we just approved, MPD has a history of injecting folks with sedatives against their will, and that was somewhat of a bombshell report when that came out several years ago. And so we need to tread lightly and sensitively on this topic, but we also need to acknowledge the real need in the community. And I think, like, to Chair Chavez's point, the real issue is we don't have enough facilities for folks. We don't have enough treatment options for folks. It's my belief that when we have culturally appropriate treatment options, people will actually want to pursue that support. And so we have to balance the fact that sometimes maybe people are hesitant to enter into the treatment that's available to them. That doesn't always mean that they're refusing treatment. Sometimes just the treatment that best fits their needs isn't available. And so I'm excited about what our policy and research team is going to unearth when it comes to this topic, because this is really one of the most complex topics we're facing as a city. So I'll be supporting this today with all of the same caveats that I think some of the other folks up here have expressed.
All right, no one else is on cue. So on the motion to approve items 1 through 4, all those in favor say aye. Aye. Those opposed say nay. That carries, and the consent agenda is approved. Before we move on to our main discussion item, we'll address item number 6. At our November meeting, we had planned to discuss this item at today's meeting. However, based on conversations I've had with staff, I move that this item be postponed on January 22nd, 2025, in order for those meetings to occur. May I have a second? Second. Is there any discussion? Yeah. All right. All those in favor? You're speaking? Okay, speaker management. Okay, Vice Chair Wansley.
Yeah, thank you, Chair Chavez. I did just want to provide a little bit more context on this. So as you highlighted at our last public health and safety meeting, we were informed by our city attorneys that we could no longer pursue strategic plans as we've been working this past year to advance the Safe and Thriving Communities Plan formally through the legislative process, as we've done with other plans like the Transportation Action Plan or Climate Equity Plan. Again, many other plans that have gone before the legislative process in coordination and collaboration with the administration. In light of learning this information, my office did ask the city attorney's office to produce a official memo outlining this opinion and to present it to the administration and enterprise oversight committee. That presentation and discussion should take place in the next few months and hopefully provide more clarity on next steps in regards to what we can do as pertaining to the Safe and Thriving Communities report and plan in this space, and strategic plans as a whole. So that said, I believe you said your motion was to postpone to the next meeting. I did want to get clarity on if there's a way to just table this, considering the city attorney's office did name it. It was going to take some time to prepare that memo, and it likely won't happen by the next meeting, but to be able to keep this item on the agenda until that happens. So I wasn't sure if tabling would have been the appropriate motion.
If the clerks or city attorneys can help us with what the best outcome, I guess, is here.
In terms of, Mr. Chair, to Councilmember Wansley's question, in terms of kind of how our legislative process works, I think the body could do one of two things. Either we postpone to a specific date. It does not need to be next cycle if we know it's not going to be, and that will let the public know kind of the earliest it might be back. If we're really not sure when this is going to come back, I think another option would be to simply refer the item back to staff, and then they can submit it when they're ready with the presentation.
So for clarity, I did submit this item.
Right, that's right, that's right.
And it's likely because, things with staff. So I would be more open to wanting to have this on the agenda for the reasons why we're having this issue. If we could postpone, indefinitely. But yes, I see Councilmember Ellison.
I was just going to ask the clerks. I think we can just carry it over from cycle to cycle, right? Like, and we don't even have to take a vote on that if there's no objection. Okay.
Oh.
So, I just wanted to. Yeah, I thought that'd be the best.
Do you have a motion, Councilman?
I don't think we have to have a motion. I think that if you indicate as the chair that you would like to hold this item in committee until whenever, we can just hold it cycle to cycle. I don't even think we have to have a vote on it.
Okay.
Thank you for your
Thank you.
sage wisdom, senior council member.
So we're gonna hold this item in committee, and I just want to confirm with the clerks we don't have to take a vote on that.
As Councilmember Ellison said, I mean, the agenda already says we're postponing it to January 21st, I believe, 22nd. I don't have it in front of me. But so if the body takes no action and there's no objection, it will be on the next agenda, and we can decide at that time whether it's ready to proceed forward or whether we're going to continue to postpone it.
So without objection, I guess that is what we're doing. Sounds good. Okay, perfect. Thank you. All right, and then we have the item number 5. So with that, we'll move on to our main discussion item for today, receiving and filing a report about the processes used to assign violence interrupters across the city. I'll call on Director Nelson Brown from the Office of Neighborhood Safety to speak on that presentation. Welcome.
Thank you, Chair Chavez. Is this working?
Now it is.
Okay. Thank you, Chair Chavez and council members. Originally, I think at agenda setting said this would be about 15 minutes. That's not true. It will be a little bit longer so that we can make sure to get all of the information out, particularly for the public's sake, because I know this is a discussion that we've been waiting to have for a little bit as it was carried over from November. So with that, I will get started. Also joining me are 2 staff members, the Assistant Director of Finance, Lindsay Erdman, and the Assistant Director of Compliance, Shanique Ruohamaki, who will help me if I forget some things. I'm sorry, Associate Director, my apologies, who will help me if I forget some things. And so if I do, please feel free to come up, and are also available for questions as well. So this is in response to a legislative directive that the department received that had multiple questions and questions within questions. So I felt like the best way to approach this is to really just go through question by question and give some answers. And as we do that, I'll also give a little additional information for the sake of the public who may not be familiar with violence interrupters and the cure violence model of violence interruption. So the first question that was posed was wanting to know an overview of how our department uses crime and safety data to determine when and where to assign the violence interrupter groups geographically in the city, and also our GVI and why GVI, which stands for Group Violence and Youth Group Violence Intervention Initiatives, and an overview of how technical assistance providers have advised on how to improve and strengthen deployment based on data. And before I jump into a direct answer to that, I want to give just a little bit of history about, let's start with the violence interrupters, and then I'll go into GVI and why GVI, since those are 2 separate initiatives and operate slightly differently. So one of the things that I think is helpful to get clear on is the language that we use in neighborhood safety and in safety initiatives across the country, because I don't think that is something that the general public understands. When we're talking about violence interruption, and here in Minneapolis, that we refer to this as our Minneapolis initiative, we are talking about a cure violence model. So that model was invented, or was the brainchild of Dr. Slutkin, who was a medical director at the University of Illinois. The model itself is, welcome. I'm actually happy to see Councilmember Cashman in, because I know this was important to you as well. I'm just getting started. So the idea behind violence interruption, Dr. Slutkin worked with disease. He's a medical medical doctor, and an easy way for the public to think about violence interruption and how it's used is to think about how disease is transmitted. So if I have a cold, for example, it's most likely that my family, my friends, and the groups of people that I interact with will also catch that cold, so that transmission. Violence, our research tells us, works in much the same way, in clusters and groups of people through norms and thinking and behavior that perpetuate or support violent activities. So Dr. Slutkin's model for cure violence, hence the name, is to use credible messengers, people who are also from the same area, from the same group, from the same neighborhood, that understand language, understand the culture and the norms, to bring a message of nonviolence and how to end violence to those groups to interrupt the transmission of violence. So that is why they are called violence interrupters, and that is the cure violence model. Dr. Slutkin was the director of the agency Cure Violence Global, which is located in Chicago, Illinois, and originally this model was called the Ceasefire Initiative. So it's important for folks to understand when I'm on the dais or we're in the street and we're talking about the Cure Violence model. When I say model, I'm talking about the model, and when I say Cure Violence Global, I'm talking about the organization. So it's important to make that distinction. So that is, in essence, in a nutshell, the strategy. We employ contract with organizations who employ workers who share the same background, come from the same neighborhood as those who need to be reached, and in this case, those at most risk for violence. We hire interrupters who already have the trust of community members and are able to influence and change behaviors. So with that, let me go to the next slide of how we use crime and safety data with violence interrupters. So we have credible messengers. They use their relationships and their partnerships, and it's important to know what this initiative actually focuses on, particularly if you're interested in having violence interrupters in your area. The focus for this model is to reduce gun violence, decrease homicides, decrease non-fatal shootings, and decrease retaliatory violence. So if there are issues in your area that are not around these things, then we may want to talk about other initiatives or other models. But this is where this works best. The data sources that we use that work best come directly from the boots on the ground. That is one of the main data sources because they are embedded within their communities. To give a quick example, as a best practice, a few months ago, there was a homicide, gun violence victim who passed away. One of our community trauma response organizations was working with the family. As they were preparing for the funeral, that organization got knowledge that we were expecting retaliatory violence at that funeral. So that organization was able to call one of our violence interrupter groups, let them know of what was happening and what was brewing. The violence interrupter group then came to the funeral and was able to keep the peace, mediate, bring a credible message, and that funeral went forward without any violent incidents. That is a data source that is so valuable that we would not find in our crime data. We would not find that in MPD data. That is data that comes directly from the boots on the ground and is incredibly helpful in this model of violence interruption. So that is just one of the main ways that we use data to inform how groups work. Next slide. So as I talk about the Cure Violence model, there is a potential for us to become a full-fledged Cure Violence site because the owners of this model actually have a certification, and we are planning to become certified, to become a full-fledged cure violence site. So as we're doing that, this is an answer of how technical assistance providers are helping us. We have a current contract with Cure Violence Global, and with that, they are informing us and our vendors about how the model, best practices across the country, lessons learned across the country, as well as the best practices in utilizing data to inform our decisions. They have also, over the last year, helped us to write our new RFP. So the current contracts that we have in place now will end March 31st of this year. And we have already written and released, and the RFP to select new organizations has closed, and we're now in review. Cure Violence Global, in their current contract, helped us to write that RFP. They are reviewers as we make the selection for the organizations that will start in April. And they are assisting us with data collection and what data collection will look like moving forward. At the same time, I think council is aware, we have, once the contract with Cure Violence Global ends, we will be looking to continue technical assistance, and we had to move forward with an RFP for that as well. And in that RFP, the selected vendor will assist us with data collection and analysis. We're asking that that selected vendor have a database for us to utilize and be willing to analyze and collect that data for us. And in essence, provide us comprehensive technical assistance. So we will work hand in hand with the selected vendor on analyzing crime trends, analyzing the information we receive from violence interrupters groups right now, and they do report outputs to us on a daily basis. And then make the decisions on what the model, how the model grows moving forward. So I hope that's clear. Okay. So the other part of question one was asking about the Group Violence Intervention Initiative and the Youth Group Violence Intervention Initiative, and that's what this slide is referring to. So again, it's really important to understand the primary focus of this initiative, and the primary focus here is to reduce gun violence and homicides associated with groups and intervene with the individuals in those groups to disrupt cycles of violence. The main component that is used in the GVI and YGVI models is called focused deterrence. What that basically means is research tells us that when it comes to gun violence and gun homicides, in most cities across the country, there is a smaller number of individuals who are responsible for a larger percentage of those homicides. So with the focused deterrence strategy, you are focusing on that smaller number of individuals to decrease your overall gun violence homicide rates. It's extremely successful in all of the cities that it's employed, and it requires a lot of collaboration from a lot of different stakeholders, which we have here in the city of Minneapolis as well. This is a referral-based initiative, so the individuals that are focused on come through referrals from MPD, referrals from probation, and referrals from schools. So this requires a lot of collaboration and a lot of folks on board to get the referrals in order to know where to focus our interventions. As far as technical assistance, we have a current contract with the National Network for Safe Communities, and they are currently working with city staff and all of our stakeholders to help us map group locations. This is one of the important pieces, most important pieces of the initiatives, and as we move forward, we definitely want to double down on this piece, but we're going to have to take into consideration our new budget and what that looks like with contracting as well. So what they help us do is to map group activity, locations of those activities, norms and behaviors, and then we all share that information that then directs where the interventions go. They also help us to create a scorecard that tracks local violence and group activities and group dynamics, and we regularly update what's called the group audit to review those incidents and assess next steps as we move forward. So that is the difference between GVI and violence interrupters. Hopefully that helps. Okay. The second question that was asked was an overview of the evaluation criteria for the Violence Prevention Services, which used to be called the Violence Prevention Fund, and the Community Trauma Response funding and applications, including geographic distribution, amount of funding, and intended program outcomes. And I'm going to take those individually as well, starting with community trauma response. These 3 steps that you see on this slide is a general overview that applies to most all RFPs and what we're looking for with services. So when reviewers get these applications, what we've asked the applicants to provide and what they are reviewing is, 1, an agency overview, fiscal responsibility and how capable they are of managing whatever award they're given. And then they're also asked to lay out a full project plan. So that includes what services will be provided, how, where, when, and how will they ensure success. So these are the elements that the reviewers are using to evaluate the community trauma response initiatives, as well as all of the initiatives that provide services in NSD. Once reviewers score those applications, they are ranked. And once they are ranked, we are bound to stick to those ranked applications. So whoever scores the highest, we will enter into contract negotiations with. It depends on funding. It depends on geographic location, whether or not we can fund everybody or only select a few. But we have to stay in line with the ranking of the reviewers. Once we have that, then we are able to enter into negotiations with contracts, and that is where we take things into consideration, like high activity in geographical locations across the city, what special populations need attention, what services we have gaps, and then we make our award decisions based on those negotiations with those selected awardees. Sometimes, we can award everyone. Sometimes we can't. Sometimes our needs differ from the applications we've received, and so we work with those organizations to see if they can tweak their scopes of work or change or take on additional areas. All of that happens in the contract negotiations. And the next slide. This is a list of the community trauma response organizations and their geographical area. I won't go through all those. I've also presented this previously, but you have that in front of you. The next slide is those same organizations and the amounts that they received to do their work. I will add the caveat that these contracts that you see with these amounts, these contracts ended December 31st, and we extended these contracts for an amount of $75,000 each to continue their work through August of 2025. Once we reach August of 2025, we'll have to decide what it looks like moving forward, but this has been a pretty successful initiative that we'd like to see continue. It's just going to, we're evaluating now what our budget looks like and what that RFP can look like as well. The intended program outcomes with community trauma response. This is one of the initiatives where we're piloting a new data collection report, and we've aligned it directly with the Safe and Thriving Communities reports in the three areas that the report says are gaps for us. So with these programs, we're currently collecting data around those three areas, which are trauma and healing services, justice and reentry services, and resilience-oriented services. We have thankfully been able to open a position for a data analyst because Council, thank you so much, awarded us another position. That position is open right now and will be mostly responsible for the collection and analyzing of this report. And on the next slide are the questions that you'll see from the organization standpoint. So these are some of the questions that are on that report to collect this data. And you'll notice that there are both qualitative and quantitative questions so that we can get a full comprehensive view on how to evaluate and success of these programs. I'm just at question 2. And question 2 asks us for an overview of the evaluation. Oh, actually, this is second part of question 2. So same question, but for violence prevention services, previously called Violence Prevention Fund. And as you'll see, the evaluation criteria is mainly the same. We still ask for an agency overview, fiscal responsibility, and project plan. And these are the selected organizations for the most recent violence prevention services. And their geography. So again, with contract negotiations, this is where we took into account trends, crime trends, and areas. And we did our best to award as many organizations as possible to cover as many areas as possible. We had 50 organizations apply for this initiative, and with our funding and taking into consideration geography, we were able to award 25 of the 50 that applied, and we did max out that funding. And the second slide is a continuation. And the next slide gives you the total amounts that were awarded. With this initiative, we typically get a lot of applications, and so as to not burn out reviewers and to be pretty consistent, we typically separate it out into categories. This past year, we separated it out based on funding amount, as well as we had a category for built environment. As we move forward, we will use crime data and trends and information and input from council for your areas to determine whether or not we continue to categorize and what those categories look like. But once we enter into those contracts, we're bound by those until those contracts expire. This money was used with a combination of general funds and ARPA funds. And so some of the contracts have expired. They had staggered dates, and those would be the ones that were funded with ARPA funds. They would have expired 12/31, and we can get that information to council if necessary. Oops. Okay. 2 more slides down, the intended program outcomes. This is a quick snapshot of the data that we collect with these programs. You'll notice again that the information is both qualitative and quantitative, as well as some additional questions around financial reporting, so that we can start to evaluate the cost of violence prevention and safety in the city. Question 3, the frequency in which our staff repeats data analysis in order to account for shifts in violence patterns, ensuring the assignments are responsive to the changes in the environment. So here again, it's important to understand that a large amount of our initiatives are really based on relationships and ties to the community. That's one of the most important things that we look for when we're selecting organizations. And once those organizations are selected, we are bound by contract to their scopes of work. However, in addition to that, in order to mitigate some of the restrictions that we have because we're bound by contract, what we're doing along with OCS is we are holding bi-weekly meetings, and we are assessing data trends bi-weekly, not only with the organizations that NSD funds, but we're also reaching out and meeting collaboratively with other organizations across the city, like Metro Transit, the Park Board is a part of those meetings, the county is a part of those meetings, Safe Communities, and we all come together bi-weekly to review current trends in violence. As you all know, violence can move from neighborhood to neighborhood, block to block, so we are doing this twice a month currently to collaborate and discuss how we can work together and maximize our resources in violence prevention, intervention, and restoration. Some of the things that we talk about and that is reported back to us is locations of canvassing efforts, locations of interrupting efforts, locations of established individuals and their relationships, so that if there is a hotspot that pops up across town, we already have a good idea of who may have relationships in that area, confirmed hotspots, and we use all of that data to inform our strategy and our collaboration. Question number 4 asks us for an overview of how we, actually, question number 4 is really answered with question number 3. The question asks how we collaborate with other entities that also have unarmed public safety presence. We're doing this bi-weekly, in those bi-weekly meetings. We started with a smaller group. We really see our unarmed responders as the experts. And so as they talk and collaborate together, when they want to add to that group, we certainly do invite whoever is needed. And we keep that information close to chest, and we collaborate well in those meetings. That's just the answer, okay. Question 5 is the metrics by which we evaluate the success and effectiveness of violence interrupters. This is actually built into the Cure Violence model. They are established metrics that are used in multiple cities that use this model. There are 3 components that we're looking for, 3 strategies, and that is to interrupt transmission, to identify and change the thinking of the highest potential transmitters, and to change community norms. So again, when thinking of this model, if you think of it as the transmission of disease and that violence operates in the same way, it makes sense that these are the strategies that are used in this model. The metrics we're looking for are stopping violent events before they happen, reducing the number of violent individuals, and creating social pressure to stop violence. So that gets at the community norms. The results: reduce violence and safer communities. Question 6, and I believe the final question, is when and how will we report to council on outcomes of violence interrupter programming to council? And as the current contracts are set to expire March 31st, we are compiling all of the information that we've been collecting from the violence interrupter groups. They update their data daily after their shifts. And we're going to put that into a comprehensive report that will give us ideas of trends and success, challenges, and we will use that information to inform how we move forward, next steps, and what future RFPs look like. And we will be sharing that report with council. Beginning of April, then we will have our new RFP will be in place. And so this comprehensive report will also be used to strategize with that new group of awarded contractors. And that, I believe, is it. Let's see, is it? Yeah, I said that is it.
Thank you.
Thank you.
And I'm looking at speaker management. But before I do that, I do want to welcome Councilmember Cashman, who authored this legislative directive and was here for the entire presentation, but I didn't want to stop you from speaking.
Thank you.
Councilmember Cashman.
Yes, thank you, Chair Chavez, for recognizing me. I did write this legislative directive because I was concerned about specifically gun violence happening in Ward 7, but along the borders with other wards, at 19th and Nicollet, which borders Ward 6, and also in the Warehouse District, which borders Ward 3. We've had fatal shootings in this past year, and I wanted to learn about the transparency of the data that's collected by the groups that we contract with. And so one thing I'd like to ask you about is actually when we will be switching to the Cure Violence database instead of the kind of Minneapolis daily debrief form that I know is going into like a smart sheet right now, but it's not accessible to us or to the public to actually see the metrics that they're assessing. And so when will that transition happen, and also will that become a public dashboard at that point, or at least accessible to city staff?
Yes, thank you so much for that question. Yes, I'm going to start from the back and go backwards. Yes, the plan is to make this information into a public dashboard, and that is one of the primary goals of our new business data analyst, or data analyst, whatever the title is to create that along with IT here and with the technical assistance provider. So that position is open currently, and I believe is set to close in 2 weeks or so. In addition, along with that, our technical assistance provider will be helping us to create the metrics that are shown publicly that will maximize the information that we're collecting. And that RFP closed for the Cure Violence technical assistance.
It closed in November. We're still evaluating.
Okay, that RFP closed in November, you said, and we are in evaluation right now. So that was a request for whoever the vendor that's going to be selected to do this for us. So I would, if I were to give, I can't give a strict timeline, but if I were to guesstimate, I would say we would have that technical assistance provider on board within the next 3 to 4 weeks, and then we will start working on what those metrics look like and how to get them available to the public immediately thereafter.
Okay, really appreciate that. There's been a lot of capacity building and a lot of new groups being onboarded, but with the duration of contracts being kind of short, I'm a little concerned about like gaps in service. For example, between March 31st when the contracts end and when the new RFP goes out in April, like what happens during that period? And for some of us in our communities that really depend on this service to complement police tactics and complement police presence, what can we expect during that time?
So it should be seamless. As these contracts are ending now, we are right now reviewing for those that will start in April. So it should be seamless. I can't, guarantee that they'll be the exact same organizations because we don't know the outcome of the RFP. But I do think that it's worth in the future, or maybe later this year, having a conversation around the duration of the contracts. Currently, they sit at 1 year. It may be worth it to talk with our technical assistant provider and with council in this committee on maybe having 2 to 3 year contracts. There are lots of options available to us, but it should be a seamless transition. We should not see an interruption of services. In our timeline, we have planned to select our technical assistance provider prior to onboarding the new organizations in April, so that they're right here with us to get them trained and onboarded and work alongside of them. So we're asking a lot. We're doing a lot of collaboration with our technical assistance provider. And Shanique is saying something I forgot.
Shanae Krumaki, Associate Director of Compliance. I wanted to clarify that we'll be coming forward with RCA for both the technical assistance provider and the vendors for Minneapolis, April 18th.
Oh, thank you.
And both contracts will start on April 1st.
Thank you.
Sorry, the RFP goes out after the contracts start?
The RFP, go ahead.
Yeah, so we released the Minneapolis RFP sometime in October, and we also released the technical assistant provider, I believe, in November or October. So the plan is for the contracts to start at the same time. So the RFP is already closed, so we're in the
I see.
evaluation process.
Okay. Yeah, well, thank you for the transparency. Thank you, Chair, for, having me here today to talk about this. And I think it's going to be an ongoing conversation this year as to how we use data more effectively and how we show the effectiveness of this service that I know is really important, and I certainly want to see more of in my ward, and to have the ability to track that progress and to show community members what's working and what's not working, so that everyone in the city can participate in that conversation with us would be really helpful.
Yes, thank you for that, and thank you for this council's support in helping us, our department, build the infrastructure so that we are able to track data more effectively.
Awesome. Next up, we have Councilmember Palmisano.
Thank you, Mr. Chair. I might need to go back and actually listen again to the earlier part of your presentation, because I must admit I'm still not understanding the difference between violence interrupters and GVI. You use a lot of the same terms for both, but they're different. Is there an easy way that you use to distinguish between one and the other?
That is a really good question, and thank you for that. This is an issue that is nationwide, and the industry of community violence intervention is right now releasing a toolkit to help the public better understand and to standardize language. I'd be happy to share that as well. The way I think of it is we work with community violence intervention, which is like an umbrella. So if you think of public health is like an umbrella. And underneath that, sticking with public health, you'd have infectious disease, you'd have maternal child health, you'd have communicable disease. Those are different strategies within the umbrella of public health. It's very similar here in that we have community violence intervention, and then we have the violence interrupter strategy, the focused deterrent strategy, which is GVI, and then we have hospitalization-based services. So there are three different strategies under the umbrella of community violence intervention. Violence interrupters and GVI, when we're talking about the Safe and Thriving Communities report, would fall in the prevention section. When behavioral crisis response was in our department, it would fall under response. And then next step in community trauma response, that's after a crime has happened, and that will fall under restoration. So when we're looking at violence intervention and GVI, we're looking at two prevention models that do slightly different things. They both focus on gun violence and gun homicides, but one focuses GVI more on individuals and high risk individuals, and they get those individuals through referrals. So MPD will say, you know what, typically without this service, these are individuals that we would be really watching very closely, and we would be looking at arrests. But now we have GVI, we have this service. So we're going to let you know who these individuals are, and we're going to take a step back and see what you can do to offer assistance and resource. That's the focused deterrence. Violence interrupters, on the other hand, are more widespread. So in their neighborhoods, they already have these relationships. They're mostly former offenders themselves who have changed their lives and are spreading a credible message, and they use the knowledge of their relationships to talk to folks and to intervene and mediate in violence before it escalates, and sometimes even during an escalation. Once it reaches the level of a crime, though, then we're outside of the scope of the violence interrupters. And I think that is where people sometimes get confused, because we are typically thinking about a traditional law enforcement response that comes in and responds once things are escalated. And that's not exactly what this is. This is community helping community, if that makes sense. Does that help? I know it's confusing.
It does help, and it also feeds into my second question, which is similar to Councilmember Cashman's points. The pieces of this I was most interested in was figuring out what metrics staff and others could use to evaluate the success and effectiveness of violence interrupters. I mean, we've had our chief of police here saying it's really hard to measure prevention.
Yeah.
To measure something that didn't happen and the prevalence of that. So, I'm pleased to hear about your collaboration with community partners to review trends and to maximize our resources. That's great, because we can't go it alone.
Yeah.
But then, as you mentioned, that current contracts expire March 31st, Councilmember Cashman noticed and pointed out, are these for the violence interrupters then and not the GVI?
Yes.
I hope I just used those terms correctly.
You did.
Okay. So if I understood you a moment ago, you said this should be a seamless transition of services. But how will we be able to adjust an already executed contract based on whatever that data generates during that review?
We are going to have discussions around amendments potentially, and we are working with the technical assistance provider, who I hope to have in place before the contracts expire, so that as we're writing those contracts, we have them right next to us to review the data that we've collected, inform us with current trends across the country, so that we can implement those into the new contracts that start in April. And we're able to do that because we have a current contract right now with a technical assistance provider who is willing to help us to get this done before those new contracts come into play. So they are not only helping us write those new contracts, but they're currently reviewing as well those that have applied. So we've got that technical assistance in place right now. The only slight adjustment we'll have to make is that when we went before the Permanent Review Committee, we were given the directive to open that technical assistance up to an RFP, and so we've had to do that, and we'll have to select a technical assistance provider. The department's preference would have been to continue with who we currently have, but we cannot do that without the approval of the Permanent Review Committee, and I'm going to get in trouble for saying that today.
Okay, so these are all different initiatives, and I appreciate it. There's a lot going on here, and
Yes.
it's kind of hard for me to mentally track, but you clearly have it all together, and you just explained it very well.
Thank you.
Thank you. Next up, we have Vice Chair Wansley.
Thank you, Chair Chavez. Thank you for the presentation. I do have a number of questions just to get started. As we're going into 2025, can you share with the public who we can expect to see delivering both Minneapolis services as of right now? I know you mentioned contracts are going to be expiring soon, as well as GVI and YGVI. I know I included YGVI and GVI as part of this directive because they are part of the Cure Violence model and they are part of carrying out our violence prevention and reduction efforts, and technically should be part of deployment or resource deployment conversations as well, which you did mention in this presentation. So it'll be good to know, can you share what groups are currently working with the city as of now?
The organizations, I do not have that in front of me, however. Okay, thank you, Lindsay. So this is GVI here? YGVI and GVI. The current list is cause and effect, change equals community, change starts with community, touch outreach, urban youth conservation, and W. Berry Consulting. Are these additional? And here are the currently funded Minneapolis organizations. Central Area Neighborhood Development Organization, which is a fiscal sponsor for commonly known as Mad Dads. Metro Youth Diversion Center, Restoration Inc., Touch Outreach, and We Push for Peace.
Okay. Thank you for that. And then now I'm going to go into questions related to the slide, specifically going into slide number 5. Just going back to this piece about the Cure Violence site. I was really confused about what it means to be a full-fledged Cure Violence site. Prior to even your tenure, from my understanding, and also prior to the contract interruption we experienced last year, we've always been in contract with Cure Violence. So what makes the difference of being full-fledged versus not? Yeah, can you spell that out a little bit more?
I can. Yeah. So we've definitely always been in contact with Cure Violence Global. They now have a specific certification that lasts for 3 years. And so they come to your city, and if you go to their website, you'll see the cities that have already gone through the certification. And our goal is to have Minneapolis listed as a Cure Violence site as well. So they come and they work with our city for that 3-year period and actually certify our organizations as Cure Violence sites, meaning that they are actively employing the Cure Violence model as Cure Violence Global has packaged it. So that is the goal that we're looking for. Previously, I believe we were unable to do that for whatever reason, but the last couple of years, Council has given a generous amount of funding, so we are now in a position where we're able to do that. And that is also part of the technical assistance, which further complicates the directive to issue an RFP for that technical assistance.
Okay. That's good to know. And then now going to slide 6, a little bit more around the technical assistance providers, which I know, again, Councilmember Chavez and I know we spent a lot of time really diving into this piece, as you mentioned, advocating for funding and restoring relationships with those providers. I did want to speak specifically about John Jay, which I know translates into NNSC, in terms of sharing more specifically the tools that they have given you and how that has more specifically impacted your work, even just in the last 6 months. Again, I wanted to see a little bit more concretely through graphs and things of that nature of like what that has translated to. I know you list the scorecards and things of that nature, but yeah, can you share, how that has more specifically impacted your work?
Absolutely. Thank you for that question. So it has been a definite period of reset for us over the last year. We had a we have a dedicated position for this that has changed hands. And so that position is actually open again. So a lot of the work that they have really helped us with has been, one, looking at the new RFP, and two, onboarding and training our new staff, and three, helping us to restore relationships after this reset. Last year, however, last summer, they did come in, and I believe is also scheduled for this month in January. GVIU is scheduled. So the mapping that I talked about and mapping out the activities of the groups is scheduled to happen this month, along with some comprehensive training for both law enforcement, our staff, and other stakeholders in that reset, so that people really fully understand the model, and then we can start to do that mapping and sharing that information. So it's really been they've really been really helpful in helping us understand what it looks like and get that reset and rebuild those relationships. Because in this particular model, if the relationships are broken, it's very difficult to initiate these initiatives. And we're really at the top of talking about what that mapping looks like for this year. Last 2023 of August was the last time we did mapping. And so the organizations have been using that same information, but now that information is outdated, and it's time for us to redo that audit, and that is what we're looking forward to here in 2025.
And just clarification, you mentioned the position changed hands. Are you meaning on the John Jay side? Or
no, on NSD's side. So we had a body in that FTE, and now that FTE is open again.
What FTE position specifically?
It's the program manager or program specialist for GVI. So that is the person who coordinates all of the stakeholders together in our department. So John Jay provides that position with training and technical assistance on a weekly basis, but it is currently open.
And correct me if I'm wrong, I thought we just had hired someone in that position. So was a person even in that position for even a year?
No.
Okay. And when you mentioned the mapping piece, is that the same as I believe partners mentioned that they do the group violence intervention problem analysis report that they last did, I think that maybe in 2023 that you're referencing? Is that what you're talking about when you're talking about the map?
Yes, that is exactly what I'm talking about. We also refer to it as an audit.
Okay, the audit, okay. And then going off into, this kind of builds onto slide 21, in terms of some of the things that you listed that you have done. I did want to get clarity on, was this all focusing on just for 2024? It wasn't clear like the timeline of the actions that were listed here.
I'm sorry, my slides are not numbered.
It's basically the what have we done slide.
Okay. Yes, this one, the data analysis. Okay. Let me give it a quick glance. Oh, yes, this would be a collection of things that have been done over the last year, primarily 2024, and especially the top few, the biweekly meetings, the outreach, the collaboration, all of that. Really, we've done in collaboration with OCS. So Director Harrington has been very, very helpful in those top bullets or top numbers. And the number 4 is what we're looking to do with that new RFP in technical assistance. And that's the database that I talked about. And number 5 5. Number 5 has been information that we've been collecting even prior to my coming on board. This is the smart sheet that Councilmember Cashman referred to, but we are now working with our technical assistance provider to maximize the use of that information as we're collecting. So this would be really 2024 up until now, and then if we take number 4, that's looking toward a goal that we've put into the RFP with the technical assistance provider, if that helps.
Yeah, because it reads utilizing as if like it was already happening for 2024 in terms of the database, but it sounds like, okay, a goal for 2025.
Right.
Actually diving into point 3 or bullet point 3, where it talks about, while this new strategy is being developed, can you talk about what is the current strategy of violence interrupters receiving this information now?
So right now, it's happening more informally. When there is information that needs to be gleaned by violence interrupters, they have relationships that they can utilize and access, but there is not a formal collection of information right now. So informally is the way this is happening right now, and this is one of the things that we're looking forward in 2025 to having our technical assistance provider tell us how other cities are doing this, what's been successful, what hasn't, and then help us formalize this process as it's been informal up until now.
Okay, that kind of segues into actually bullet point 5 in a way, because I'm actually interested in you walking us through how these daily briefings, how they look like, and essentially who are involved, especially since you said they've been happening for quite some time. And basically, again, like who decides, who are the final decision makers at these meetings? Basically, how are decisions around resource allocations made at these meetings? For example, like if an incident occurs on a Monday night, does the Tuesday meeting discuss strategies that NSD can deploy for Wednesday? Because I think this is also the crux of why we did this legislative directive. To get a sense of, again, if these meetings seem to be a critical piece around how resources will be deployed on a weekly and daily basis.
Thank you for that question. I'm happy to clarify that. So we again consider the organizations that we fund the experts. We don't deploy them. They're the experts, they have the information, and they deploy themselves. So when I'm talking about their daily briefings and debriefings, those are held within those organizations. On a weekly basis, we meet with those organizations and we talk about information that is relevant. But I put this in here to show that these are things that happen on a daily basis within our organizations, and that's our expectation. And when they have those, they then report that to us in the smart sheet along with the other points that are listed there. So NSD doesn't have the capacity to meet with these organizations daily, but they do meet amongst themselves to debrief after every shift on a daily basis. They also, those are really important in ensuring mental health for our responders, which is another reason that they meet on a daily basis. And as they glean that information from, the mediations that have happened, like on a Monday, they will enter that information in on Monday night, and then that comes to us. So we collect that information on a daily basis, but we're not at those meetings on a daily basis. They are the experts. They know what's happening in their areas, and they are able to then, so this was really to show how they really deploy their initiatives with their expertise, if that makes sense.
Okay, yeah, this is another bullet point where it reads as if, again, this is NSD
That
leading
makes
this
sense.
effort, and I would have assumed, because we do have a full-time position that, until you just told us now, where things to, and I think we've done that before
Correct.
prior to your tenure, where we were able to have kind of that consistent and daily kind of monitoring of things. And that
Yes.
actually leads me to my next question, again, around like this trigger point around deployment of resources. Like, essentially, what do you consider an uptick, or what would be considered as an uptick that would need to trigger deployment of resources in a particular area? Like, I'm thinking, like, does it need to take a specific number of violent crimes or shot spotter activations over a certain period of time, or a certain number of 911 calls from a specific block? And I ask this because in Dinkytown, as a concrete example, we had a number of incidents of violence occur just this past summer, and in response, NSD was able to advance an emergency contract, specifically with Somali Youth Link. And in other neighborhoods, across the city, we've had clusters of similar incidents of violence where neighbors were not able to receive that level of emergency response through, other providers that we were able to receive in the Dinkytown corridor. So I know this is in part what led to, many of my colleagues and myself asking what metrics are being used or data points being used to like motivate decisions around resource deployment. So with that, can you share what data analysis went into the Somali Youth Link contract and scope of work, and what would qualify other areas for like a similar response?
Thank you for that question. Okay.
It sounds like, or was that something that Councilmember Rainville did? I heard he wants to get in priority to answer the question.
Go ahead, Councilmember Rainville.
Thank you. I have to move. I hadn't planned on talking. So just so you understand, the Somali Youth Link is so successful within the city contract that the University of Minnesota hired them on a second contract. So that's why they're in Dinkytown. They're there on the expense of the University of Minnesota.
So my original question, though, is, again, like, how did we move the contract through? Again, and you brought it forward, Councilmember Brainville. I think you recall that this summer. How did that happen through NSD? What points of metrics or data points allowed that emergency response? And that's why I'm asking Director Nelson Brown. I am very aware that the University of Minnesota has their own separate contract with Somali Youth Link.
And so with Somali Youth Link's a good example. They were already a pilot program that already existed in the area, and they were fiscally sponsored by the Downtown Improvement District. So the information that the Downtown Improvement District was submitting to NSD talked about the success of the program, how they got in touch with Somali Youth Link, the work that Somali Youth Link was doing, and they asked us if, our opinion on separating those contracts as the contracts came to an end. So that DID contract ended, and because we had that data that we had been collecting during that contract, then we were able to start looking at contracting either with DID again. Somali Youth Link applied on their own, and we were able to get those services in place. So the data that we collected came from a contract that was already in place, and Somali Youth Link was already doing that work.
And that's what I'm trying to get more clarity on, of that. What points of data is that? Because the issue, while, Councilmember Cashman, myself, I think also Councilmember Chavez has raised this, is there's been clusters of violence that have happened across the city in certain pockets where there weren't, again, advancements of certain, contracts or responses. So trying to get a sense of what data points do NSD receives as like an uptick that triggers like a specialized deployment of resources. So what are those? That's why I mentioned, is it shot spotters? What are those data points that maybe DID relate to you?
So we are not consistent across the board with the data points that we look at. DID reports on data for their model. Violence Interrupters reports on data for their model, as you saw. GVI has separate. In this one, like I said, we meet bi-weekly, and this was raised during one of those bi-weekly meetings. And we had the discussion, which we would do in any ward with any uptick, if anyone, is interested. So right now, without the infrastructure that we're currently building right now, it's been a lot of informal. But the collection of data has been formal, but the discussions, I don't have the bandwidth or the capacity or the staff to analyze the data currently, which is why this new position is going to be so incredibly important, because this will allow us to now consistently collect and analyze and come up with the standards and the trigger points that will automatically trigger, a discussion around what initiatives can go to specific situations. So it's going to look different depending on what's happening in a specific area. Is this an opioid crisis? Is this a gun violence crisis? And then once we can assess that, then we'll know what initiatives we can either create or deploy or adjust, but we are in the process of building our infrastructure so that we can formalize that. I would expect that those would be consistent questions that we're going to ask as we move forward. Is first, what's going on? We're going to have to do an assessment. DID, in case of Somali Youth Link, had done a needs assessment in their former contract. So this is something that NSD is looking forward to be able to do as we move forward, and that new position is really going to own that process. Does that help?
Not really, in the sense of, and maybe this goes to slide 23 with the data analysis, with the biweekly meetings, I'm assuming it's MPD at these meetings as well as of now, or any representatives from MPD?
Not as of now, but that is in discussion. But the information is MPD information. And this is where we collaborate with OCS, because we didn't have the infrastructure. So Director Harrington would be able to tell us the exact data points and how she gets them, but it is information that OCS helps us to get at those bi-weekly meetings.
The reason why I asked that, not just around just MPDs, because I think of, and maybe it's just a lack of clarity of the uptick, because you mentioned, we were more than happy to have someone come to these meetings to talk about, having more ready deployment of resources in areas that are experiencing, certain increases of different issues. You mentioned opioids. I think for the purpose of this conversation, as you mentioned, we are strictly focusing on gun violence, and that's the model across GVI, YGVI, and Minneapolis. For the purpose of that, I think looking at, for instance, MPD has a crime dashboard, and they've come, Chief O'Hara has come to this committee many times and have reinforced, we know which block of gun violence is there's being an increase in Councilmember Cashman's ward. We know what blocks of gun violence we're seeing increases through shot spotters or whatever it might be that they're 911 calls in Councilmember Osmond's ward. Same with Councilmember Chavez's ward. They have met with, I believe, probably you also, Commissioner Barnett, around how do we get these resources there, and so much so we've made specific earmarks within the budget to get there because we're not seeing the deployment of resources. So that's why I'm trying to ask is there a disconnect in these bi-weekly meetings? I'm just trying to get a sense of what's happening as to, is it just not the tracking of data? Because the data is there.
The data is there.
Chief O'Hara has come before us and have reinforced them of saying we know where it's happening. So I don't understand, if they know where it's happening, why NSD staff would not know where it's happening, and then where to be able to have flexibility in deploying some of these resources. Or be able to relay that to our providers?
So the relaying to providers does happen on a regular basis. I think where the inflexibility comes in is that we're restricted in the contracts. So once we get those contracts and we have the scope of work, we're restricted to those organizations adhering to that scope of work. So the reason that we are now meeting on a bi-weekly basis, not just with our organizations, but others as well, is so that they can collaborate. Our scope of work puts us here. The data tells us we need to be here. Who is already there? Because our scope of work restricts us here. So the way that we get around that inflexibility is by coming together and having that conversation while looking at those data points. And I don't have the exact points in front of me right now, but we certainly can get those with you. So it's a huge collaboration, not only with city staff and city-funded organizations, but also Metro Transit, the Perk Board, the county. And that is because we are restricted in those contracts once we issue them. Does that help a little bit?
Can you actually share, so what is the barriers currently in the contracts then that are preventing you from deploying contractors based off of need? Because from my understanding, I thought it was you as a department along with staff who then create the contracts that you then propose to the vendors in which they could then accept or deny.
Right.
So what, if you are the creator of the contract, what is the problem? What's the barrier?
So we can only make contracts with people who apply, and what they put on their application. I told you they do a detailed plan and what they are going to do and where they're going to do it. That's what we have to work on. So when we award, we are awarding based on that scope of work. So as we're negotiating, we're looking at those scopes of work, looking at the data and trying to determine, where did you fall as far as being awarded? Are you ranked number 1 or number 85th, right? Because that's going to play into how well you can carry out what you said. It doesn't make sense for us to pick an organization in this area if that organization, according to reviewers, can't carry out their plan. So we've got to take into account where they fall and where they rank, and then what they said they were going to do. That's how the contracts are based. I'm going to ask Shanique if she has any additional that she wants to add. Okay. And so that's what makes it tricky, and why once the contracts go out, we know what the plans are. We can evaluate. It makes it great for administration, but not as awesome for intervening in violence, because we know violence moves. And so our workaround for that is to collaborate with all of our agencies and other agencies that do this work, so that we can all talk about what we do and use the data to figure out where we're going to go. So that is where the inflexibility is built in from the very beginning of the process.
So for clarity purposes, the RFP that we issue is based off of just static means, geographic means, just being like, we just need RFPs for providers doing Minneapolis, GVI or YGVI work in these areas in South Minneapolis or North Minneapolis, not actually based on need, which kind of undermines the points that you list in the slide on 21, where you're saying we have providers, our providers that are giving us mapping data. They're giving us hotspots that says, apparently, here's information that would show you where the needs are, but we're not creating RFPs based on that?
We are now creating RFPs that are based on that. Keep in mind that for the last 3 to 4 years, contracts have been amended. So we are just now rolling out RFPs under my tenure. These have been contracts that have been in place for 3 to 4 years. So we are now using that information to create the RFPs that have just closed, and we will be using that information as we award. So we will start to see that in April of 2025, because we've been working on 3-4 year amended contracts.
So even in that, okay, so and if you're saying we have that information for the past 3 years, at least since you've been here, and they're reporting this information through smart sheets, maybe through their invoices, I am interested then, instead of waiting until March, why weren't we able in today's presentation to get a snapshot then of like, what did it look like in August for our providers? Then what were those hot spots? What were, those locations or mapping data? Because this is also listed here on slide 21 of mapping data. That would have been great to have, especially as we were talking about summer safety plans and looking at, okay, how can we better support deployment of resources both within MPD or NSD, and what gaps of services were there. So why aren't we able to receive a snapshot of those type of things based off of data that you're saying you're currently receiving from providers?
Thank you for that question. And moving forward, we will definitely be able to do that. But keep in mind, this is, I've been not silent on the need for staffing and infrastructure in the department. We are just now getting to a point where we're almost fully staffed and with positions that are specifically focused to do the work that we need to do. This business analyst position that we were just awarded 3 weeks ago, that is open now, will own that. So I would have to say that over the last year, while we've been collecting this information, I've not had a staff member to analyze that information. So it's there, and we use it as we can, but to give a full comprehensive report that would be fruitful for council will come as we create that infrastructure, and we are there now, thanks to that new position that I had been asking for a while that I finally got approval for within the last 3 weeks. So this department has been building over the last year. This is support that was previously provided by the health department, that once this became its own department, we lost that support.
Yes, I know we've been having this conversation for like almost a year and a half now in terms of the downside of transitioning neighborhood safety, also known as the Office of Violence Prevention, out of public health prematurely. What I also do know is, Councilmember Chavez has been in many conversations with you, Commissioner Barnett, and the mayor around what can we do to support corrective actions to place NSD back on track to get you the resources you need so that we can have quality service delivery as it pertains to violence prevention work and everything else that falls under your umbrella. And I think one of the critical pieces was, again, like the technical assistance.
Yes.
Even having those reports, which I know gives concrete audits around where are the small populations in Minneapolis where we're seeing concentration of gun violence. Even being able to have those figures today, that is not information in which you or a new staff member has to regurgitate. That's already being done for you. And even being able to have that be like put forward as a report in front of us to be able to look at, or through LIMS. We didn't even get a chance to have that. So even some of the data points that I think we've been able to give you resources for, so that we can have a better sense too of like, where is this happening? Because we hear from our constituents, we see the 911 reports, we get the 311 reports, but we're looking to you all as the experts and with the meetings with these partners to also help us figure out, okay, where are the resources being deployed? And I didn't see that today in terms of like, again, I was expecting charts and graphs. You had maps here. I was like, oh, okay. And I know we've seen this before from prior leadership in NSD. So I was hoping maybe like from John Jay, maybe they were able to provide this cure violence when they came forward in August. These are things they said that they could provide to as analyses. So if those are things that you could provide to us subsequently, those maps, that would be great to have. Because right now I'm not seeing how that advocacy of resources really translating to outcomes today.
That makes sense to me. So that wasn't clear to me in these questions, but we can absolutely get that for you. I don't have that in front of me today.
Yeah, that would be good. And again, as much as we could say like overview of deployment of resources, some data, some and I think that has been consistent of we have heard like the qualitative pieces, the anecdotes. I think there is a heightened scrutiny, especially with the amount of issues we've experienced with NSC this past year around what are the quantitative outcomes that we're seeing. And any data points that can reinforce that residents are actually receiving bang for their buck the better that we're able to go and like continue advocating, and also feeling assured that like resources are being delivered in an intentional and effective way.
Makes sense.
Yeah. That's all I have.
My legs fell asleep. Long discussion.
Thank you.
I was not even
You ran up.
speaking. My speaker management is not on, so I'll repeat it for the public. Just asking Councilman Rainbow if he had more comments. That is a no.
And I said that my legs fell asleep.
He said more than that. Vice Chair Wanda.
I just want to know, just for also public record, because it seemed very informal when I asked Director Nelson Brown, but as a staff memo follow-up, and I can also, Rachel, like follow up with you over email, I am asking concretely for any data tied to the maps that can be shared that's not sensitive or needs to be redacted to be shared with us, reports that has been provided to NSC from our technical assistance providers, that either that audit that has given us information around where gun violence is taking place in Minneapolis, for us to also be able to receive those reports.
And if we can get that over email, because it's a long question, we'll figure that out. Thanks, Rachel, and thanks, Vice Chair Wansley. All right, seeing no one else on queue and no further questions, I will direct the clerk to receive and file that report. And seeing no further business before us, I will declare this meeting adjourned.